PAD, or peripheral arterial disease, are blockages that occur throughout the peripheral arterial system, which would include the arms, legs, and aorta. Patients that classically present with PAD have strong family history perhaps, but they can also have risk factors such as tobacco abuse, diabetes, obesity, sedentary lifestyles, those sort of factors. Signs and symptoms of PAD can be quite varied, but the most classic initial presentation would be pain in your legs, especially with activity. PAD is often diagnosed simply with a physical exam. We have adjunct tests that we use such as ultrasounds, cross-sectional imaging like CT scans, and even invasive imaging like an arteriogram. Sort of most advanced presentations of peripheral arterial disease and potential endpoints if left untreated are limb loss and even death, but limb loss would be our biggest risk factor that we're trying to prevent. Exercise is great. That's one of our #1 recommendations. If you can walk even 30 minutes a day or several days a week, that's the best single thing you can do to prevent your risk and improve the quality of life once you're diagnosed with it. Other factors such as stopping smoking helps, controlling your diabetes, watch that A1C, and lose weight if you're obese are all beneficial. There's a huge spectrum of peripheral arterial disease, and it sort of depends on the severity of your symptoms and the degree of your blockage as far as the best approach to treat it. Luckily, a lot of the procedures are minimally invasive outpatient procedures that can be done and let you go home the same day with near immediate improvement. An arteriogram is often our first step, and an arteriogram is sort of like a heart catheterization. If you've ever known anyone that had one of those, we go in, we access an artery either in the arm or leg and are able to take pictures to identify the blockage and treat the blockage all in one procedure as an outpatient. Once we're doing the arteriogram, there's several options as far as how to treat the vessel that's diseased. Sometimes it's as simple as a balloon angioplasty, which we just use a balloon to sort of stretch it out. A stent stays in there and helps act as a spring to hold that vessel open. And there are other modalities like atherectomy, where we sort of clean it out with a Roto-Rooter or use a laser to sort of core a channel, and multi other technologies that we can use. We like to think of peripheral arterial disease as a chronic condition, and it's one that we manage rather than completely cure. It required a lifetime of sort of injury to develop this disease, and it will typically stay with you to some degree forever. One of the nice things about taking care of patients with peripheral arterial disease is we do form a long-term relationship. We see each other at least annually, and we trend this disease, we watch it, we maintain it if needed, and occasionally it requires intervention, and so we have that sort of long-term relationship that we build.